Good morning, this is Dr. Priscilla, and today we're going to do an activity where a doctor and a patient discuss joint pain during an appointment. The main thing that I want you to do is just be able to read it and understand what the dialogue is about. Then we'll do some activities to further your fluency. I'll be the patient if you'll be the doctor, okay?
Okay.
It's good to see you today, Dr. Jones.
Likewise, please come in.
Thank you. Dr. James, I'm having a slight pain in my arm.
Let me have a quick look at your chart. Interesting. Please tell me a little about this pain in your arm.
It's like a joint pain, actually. Sometimes the pain travels to my elbow and even into my knees.
How long have you been experiencing this pain?
Maybe about 2 to 3 weeks ago, or maybe even a month. It seems to be getting worse.
Are you having any other problem like headaches, stomach discomfort, or extreme fatigue? Fatigue.
If you mean have I been under the weather, the answer is definitely yes.
I see. Tell me about your daily activities. Do you exercise or take walks daily?
I do a little exercise daily. I joined the gym last week, and I play outside with my kids in the evening on warm days, like today.
Let me take a listen to your heart. Can you breathe in deeply for me and then breathe out?
Dr. Jones, when I raise my arm, it really hurts with a throbbing pain.
Please stand up and raise both arms as high as you can over your head. Let me know when the pain is unbearable.
Okay, unbearable. Arms
unbearable.
And arms with an S.
Okay.
Here, this is as high as I can raise my left arm. The right arm seems to be okay at the moment.
There seems to be some inflammation in your left arm. However, I think we should get an X-ray. Will that be okay with you?
Of course, an X-ray will be fine.
For now, just get this prescription filled and the irritation should stop. Once I observe the X-ray, we can discuss future plans.
Future plans?
Future plans.
Great, Dr. Jones. I'll see you in 2 days to discuss the X-ray. All right. Now, this article or this dialogue talks about a patient and a doctor discussing pain that the patient is having. Apparently, the patient has come to the office complaining of pain. What is this article about, or what is this dialogue about?
It's about a patient who comes to the doctor and he has a pain in his arm, and the doctors try to understand where is the pain, where the pains come from.
Okay, good. So this is a dialogue between a patient and the doctor. The patient has pain in her arm. She tells the doctor about this pain, and the doctor gives her a prescription and tells her that after looking at the X-ray, they will have another discussion. What do you remember? What do you remember that I just said about this article?
It's a dialogue between a doctor and the patient. The patient had a pain in her arm, and the doctor tried to ask question about the situation of the patient to understand where the pain came from.
Okay, good. So this pain that the patient is having is called a throbbing pain, like boom, 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 boom. like a thumping.
Okay.
And it's also
Okay.
known as she may have some inflammation, which means
Okay.
that it's a big bruise or it's bruised. So these are the two words that I put in green. And a prescription is what the doctor has written for her to alleviate some of the pain. The doctor asked her to breathe deeply so he can check her breathing. He asked her about exercise. And let's see what else. Are there any other words in here? Discomfort. He talks about discomfort, or she talks about discomfort. The pain is getting worse. And slight means not very much pain. What I want to do now is use these words, or as many of these as I can, and talk about the dialogue. So a patient goes into the doctor, and she tells the doctor that she has a slight pain in her arm. It doesn't hurt very much, but it hurts a little bit. Slight means it hurts a little. Discomfort that she has in her arm is what she wants the doctor to look at. There is some discomfort, so she wants the doctor to look at this discomfort in her arm. Although it's slight, it's not comfortable. The doctor asks, do you exercise daily? Exercise means going out and doing something actively. And I think she says she goes out a little, but not a lot. And she does something with her children. So as the doctor is checking her, he asks her to breathe in and out. And she tells him again that there's a throbbing in her arm. The doctor says that there's some inflammation, which means there's some damage or a big bruise. And finally, the doctor gives her a prescription so that as she experiences the pain, hopefully the prescription will make her feel better. Now, what I'd like for you to do in any way, the best way that you can, is to tell me about this article and this dialogue and try to use the vocabulary that is listed. Okay?
Okay. So it's a dialogue between a doctor and a patient. The patient comes to the doctor with a pain, a slight pain in her arm, and the doctor asks if it's a problem. He tried to ask questions about different pains like headache, stomach, or is it a fatigue or a discomfort? He asked to the patient if he do exercise. Then the doctor tried to do a diagnostic and asked to the patient to breathe out and breathe out and breathe in to see the heart. What can I say? For the throbbing, okay. The patient say when he raised his arm, I don't know how to say throbbing, because throbbing pain it seems to be a throbbing pain, and the doctor say it seems to be an inflammation of his arm, and he made a prescription to be sure about the diagnostic, and he says to the patient to do an X-ray for seeing it's an inflammation or not.
Okay, so we'll stop there. Okay, very good. There is a lot of long pauses and ahs when you're telling it, but this is a part of learning, so don't think too much about it, because as you continue to do more of these, you'll understand how I want you to sound. In this dialogue, a patient and a doctor talks about the pain and discomfort her child has after a car accident. What was the other
Okay.
what was the other pain about? This one is about a car accident. What was the other pain about that we just talked about?
About pain in your arm.
Very good. So here the child was sitting in the front seat of the car when the accident happened. We're going to start out with A, B, A, B, A, and then just pick up on your own based upon what I say. So we're focusing on the word pleasure, this comfort and delight. Earlier we had discomfort. Now we have
Okay.
comfort. Synonyms are suffering, agony, torture, torment, and discomfort. So whatever comes to you naturally is what you will respond, and then we'll talk about it. I'll read as A. Doctor, the surgery was a success. The doctor says the surgery was a success.
Okay. And then B, so my son still has pain in his left arm.
This is quite normal. In about 3 weeks, the soreness will be gone.
What should I do to avoid reduce the throbbing he's feeling now?
I will give you a prescription to help you with the discomfort and irritation. Anything.
I have to respond?
Yes, please.
What kind of prescription will you give you it?
The type of prescription that I will give to you will be one that will alleviate a lot of the pain and discomfort that your son is feeling. In fact, I think he will be delighted that he'll be able to go outside and play with his friends.
Okay.
So now that you have the prescription, I want you to call the office in 2 days for a follow-up appointment.
I have to make another appointment for what?
Yes, the follow-up appointment is for me to check to see how the prescription has helped and maybe prescribe something else if the pain and the throbbing and the discomfort has not gone away.
Okay. The appointment, I have to make it in 2 weeks, 1 week.
Okay. Well, I'd like for you to make it in 2 days. I don't want your child to have any more agony. I don't want your child to be tormented with this pain.
Okay. If he had if he had another suffering, we will discuss about it.
That is correct. If he continues to suffer, we will have a discussion in our next appointment, at our next appointment. Okay, very good. And this, my purpose is to get you to think. In this final part of the activity, we're going to practice the dialogue, and what I want you to do, I'll start again. In this part of the activity, I will read as the patient, and you will follow along reading as the doctor. Please practice this daily, as often as you can, to become familiar with the dialogue and what you would want to say without reading. At the count of 3. 1, 2, 3. This is a doctor and patient discussing joint pain during an appointment. It's good to see you today, Dr. Jones. Thank you. Dr. Jones, I'm having a slight pain in my arm. It's like a joint pain, actually. Sometimes the pain travels to my elbow and even into my knees. Maybe about 2 to 3 weeks ago, or maybe even a month. It seems to be getting worse. If you mean, have I been under the weather? The answer is definitely yes. I do a little exercise daily. I joined the gym last week, and I play outside with my kids in the evening on warm days, like today. Dr. Jones, when I raise my arm, it really hurts with a throbbing pain. This is as high as I can raise my left arm. The right arm seems to be okay at the moment. Of course, an x-ray will be fine. Great, Dr. Jones. I'll see you in 2 days to discuss the x-ray. Thank you for listening. I'm Dr. Priscilla, the founder of Speak Excellent English.